international organizations like WHO, like CPI, Gavi, Vaccine Alliance, because they spearheaded a movement to provide vaccines. It is they who really helped us. And then, of course, under the COVAX. And the USAID was very good. Once they started giving us the vaccine, they also provided us equipment so that we can take those vaccines and keep them refrigerated and take those vaccines to the rural areas. And it worked out very well for us. So in this case, I believe that our observation is this vaccine should be given to all country uniformly. Everyone has the right to have a vaccine. Because one group of people, if they remain infected, then no one is out of this danger. So this is a lesson for us. We have to look into the future, that everyone should get the vaccine uniformly on time. We should build a system so that any disaster like this ever comes again, then the world should be ready to help them out. And we should build it in the other is we must have continuous research so that we can develop better opportunities, better facilities. And we have been arguing vaccine should be a public good. In those cases, we should ignore these property rights. And if that we do, many countries might come up with, they have the, for example, Bangladesh has the capacity to produce vaccine. But because of that, the property right, intellectual right, we cannot do it. So this should be made, this sort of product should be made public good, so that other countries can produce and distribute it. So, and this, I believe, another area where has been logistic support. We have to make ready all the logistic support across the country. And most important is power of collaboration, partnership. We would not win this war without a strong cooperation and partnership. We work together hand in hand with WHO, with the Vaccine Alliance, with Gavi, with COVAX, and that is the key of success. So in future, this tells us that this world is one little small, major village, and if anything comes up here, any serious issue comes up here, cooperation, collaboration, and continuous discussion and dialogue are essential to overcome those challenges. So I would say the lesson of these is that in future we should be ready to attack this sort of issues on a collaborative way. And we should develop institutions so that they continuously do research. If there is anything like that, they should produce the vaccine and immediately disseminate information across the nation. And that will help us to avoid such disasters. They are very expensive. We can afford to buy. So anyway, finally COVAX started giving us, and we had to spend our own money, huge amount of money, to buy. Then suddenly Sinopharm was approved, and that was the Ultra. Immediately we gave order and we started buying it. But there we had another problem. The Chinese would not deliver it. I have to send cargo to pick it up and bring it back. That's another expense. Thanks to USA, they did not do that. They delivered it. Now, when we got a little vaccine, we were prioritizing who should be using it. And that's not a good policy, because if your neighbor is sick and you are okay, in the long run you'll be sick again. So one lesson we learned, in the case of vaccine, there should be uniform distribution of those vaccines. And our WHO, COVID, CP, they all should organize together, and thanks to Gavi, so that there is no discrimination in the distribution of the vaccines. And if we can ensure it, in future, this is a lesson for us. We should look into it so that many countries did not have vaccines, even at the last minute. It's because they neither have money or they have influence. We had to procure vaccine in varieties. We used varieties of tactics and strategies to get the vaccine from USA, for example. We have many diaspora doctors, professionals in USA, and they had to request the government, US government, that our parents are dying, our relatives are dying, and here we are providing vaccine, helping people to save, and our family are dying, so why don't you give? And only then they started giving us.
I think
so it was a challenge. In future, I think we should make a rule that whenever such happens, the distribution should be uniform.
Absolutely, because I think in
Thank
terms
you.
of